Many women work in healthcare and healthcare quality, but what does it take to lead and thrive at the field's highest levels? I'm Andy Reynolds with NCQA. Today on Quality Matters, a preview of a reception and a panel discussion that aims to answer those questions. The Women in Quality event takes place Friday, November 1st at NCQA's Health Innovation Summit in Nashville. Let's meet the moderator of the Women in Quality discussion.
My name is Vanessa Guzman. I am the CEO at SmartRise Health and a co-founder at Cozeva Health.
What do you do, Vanessa, when you are not hosting panel discussions for NCQA?
Our companies are focused on improving population health, building infrastructure with payers and health systems and providers so they can better serve populations. We focus on health equity, and then with Cozeva is dedicated to women's health.
You are facilitating a panel discussion on women in quality at NCQA's upcoming Health Innovation Summit, the largest event that NCQA has ever organized. Tell us about that panel.
I hosted this event last year as well, and we had such great enthusiasm, inspiration from women leaders across the country. This time around, we're hoping the audience also comes in and plays a role in that dialogue.
So very much of a participatory session for the audience and not a sit and watch activity. How will the discussion that you're planning unfold? What's going to happen?
The Women in Quality reception will focus on 3 segments. The first one will focus on cultivating oneself, understanding your purpose, walking your journey. What does that look like? The second segment will be focused on connection and collaboration. How to build meaningful relationships, how to build a trusted network. And then the third will be focused on creating and expanding that culture of quality. What areas of your life and workforce meet your goals and objectives? How are you tracking and measuring those processes? When you combine those, you're manifesting the goals that you have set.
Vanessa, you mentioned before we started recording that you're approaching this session as an act of co-creation with people who attend. What do you mean?
You co-create whatever your intention is. Event is the perfect example. When NCQ approached me, we're like, okay, we're creating a space where women and everyone, however you identify, can join and have a safe space to have an important conversation. So everyone can go home inspired, embracing their stories that create value for themselves. That's all co-creation.
I turned the interviewer's microphone over to Vanessa to ask her panelists what they plan to share on November 1st.
I'm Khanh Nguyen. I'm a pharmacist by training, have been in healthcare for over 15 years, deeply in the quality space, and I'm currently the CEO of Cozeva.
What do you have to tell us about your journey? What does that look like for you? Can you give us a snippet of where you're at today?
I came here from Vietnam when I was 4 years old, one of 6 kids. My parents gave up amazing lives and careers in Vietnam and came to America to start over. So I learned the lesson firsthand of resilience and hard work. The only requirements my parents had for us were to make a positive impact, but to also give back to the communities that needed the most help. That has manifested in my leadership and career in a lot of ways. But staying true to those values, growing up with that immigrant mentality, and leading with integrity. I've tried to model the behaviors and the actions that I expect from others, whether it's advocating for quality, being transparent and accountable, or creating an inclusive environment. That's shaped my walk and helped me lead with purpose and curiosity, and then managing challenges with authenticity.
Thanks for sharing those. What is your narrative that you're telling yourself these days at a personal and career level?
My narrative anchors around 3 things. First is the impact I hope to make within quality, within the broken care delivery system. Second piece is about growth in my personal and professional life. And then the third piece is family and friends and that broader network of people. So my narrative is those 3 areas is how do I make a positive impact? in the industry? How do I keep growing professionally and personally? And third is having that anchor around family.
That's beautiful. I'm curious, because it's centered around family and growth and impact. Tell us more about what that looks like for you.
The impact starts by making quality measurable and an actionable priority, and having the platform to share lessons and accelerate adoption of value-based care. The other piece is fostering a culture where quality isn't a checklist, but a mindset. It starts by embedding quality standards into the DNA of healthcare practices and care delivery systems to shift perspectives and improve outcomes.
What do you have to share with women who don't feel they have a voice?
Understanding your own worth starts with owning your success, embracing feedback, and never shying away from difficult conversations. The last piece I'll add is forgive yourself. Because a lot of times we all try to be great at everything. And it's okay to not be great at everything all at the same time.
Correct.
So there is grace and forgiveness you have to allow yourself so you can grow. Then the last must have is curating colleagues, mentors who champion your strengths but are honest with feedback, and learning to set boundaries to protect your time, your energy.
Vanessa spoke with another of the Women in Quality panelists.
My name is Lynn Todman. I am the Vice President for Health Equity and Community Partnerships at Corewell Health, which is a large integrated healthcare system in Michigan. I am an urban planner by training. For decades, I did work on K-12 education systems, public safety, transportation systems, housing systems, things we now call the social determinants of health. I transitioned to healthcare to apply the thinking I've been doing in the academic setting to the real world.
How do you know it's the right thing for you? How have you remained true, and how are you walking your walk today?
I remain true to what is important to me by remembering my development as a young person. I did lose my way at one point when I was working in my home discipline in urban planning. I co-authored a paper in an international journal, and I was really excited. But then I started thinking, who's going to read this? And I remember very distinctly feeling, what am I doing? Why does this matter? I ended up going back to that 13-year-old girl who was growing up on the south side of Chicago. Those experiences at that young age, the physical differences in the city, the differences in the health outcomes that I started to see as a child. At that time, I began to understand there were people who were sleeping on the street that would probably die. People sleep on the street and they die in the Chicago winters. That was an epiphany. It was those kinds of things that come into my vision when I have to tap into, why are you doing this, Lynn? You're going to stay the course because you're going to remember that by the grace of God, I didn't have to sleep rough, and I didn't have to worry about dying on the streets in the Chicago winter. I channeled that concern I had as a 13-year-old to pivot my career and live into my passion. That remains a touchstone I use when I inquire, am I in the right place? Am I thinking about the right things? That's one of the ways I walk my own walk, and I stay true to that walk.
I'll pivot a little based on what you said. The third layer that I'd like to explore is the culture of quality. How do you bake building community into building a culture of quality?
I would say that's aspirational. It is challenging to bring together the clinicians who are advancing clinical quality and communities that could benefit most from that work. There are institutional barriers to that, practical barriers. Where do those conversations happen? It's sometimes difficult for those of us who are in a clinical setting to actually get out to community at a time that suits community. then the default is to invite community to the healthcare setting. Frankly, people don't want to come to the healthcare settings. This is an essential, non-negotiable element of the quality journey. My quality colleagues understand closing clinical gaps in the equity space is one of the ways that we're going to get improved quality. They also recognize that people go home. They go back to communities where often their infirmity or their illness or disease originates, and that to close equity gaps and ensure quality over a long period of time, that the locus of interventions has to be where people live. We're bridging that gap between what happens on the quality side inside the walls of the hospital and what happens in community. So we have a continuum of care that expands not from one wall of the hospital to the ambulatory sites, but from one wall of the hospital well into the community.
Now, moving several years forward, how have you continued to build community?
One important way I show up, engage community, is I don't overpromise and I do what I say I'm going to do. Those are two big principles because the communities I work with have been overpromised things many times, and I don't want to be a part of that. A big part of how I show up is to deliver on commitments I make. I have to go in communities without my badge on, no matter what organization I was working in. I distance myself from an organizational home because people don't trust organizations in many of the communities I've worked in. It's how I show up, how I engage with people just walking down the street.
Coincidentally, and without prompting by anyone, Vanessa's conversations with Khanh and with Lynn turned to the topic of trust.
So a little bit about the contributions I get to make within the communities and markets we serve. We start by anchoring everything on trust. It starts with having trust in data, ensuring we're doing the right thing for patient care, and doing the right thing for patient care gets recognized and rewarded. Shifting the conversation from data reporting to quality improvement, having thoughtful conversations around efficient and higher quality care models.
I'm curious, given your intention, given that 13-year-old girl that lives within you, what do you think is the best approach to bringing quality care to our communities?
The thing I think of first is trust. Often in healthcare, we talk about trust and getting optimal outcomes. Trust means people will adhere to clinical recommendations. Trust means people will come to you before an illness gets too far. How do we get the community to trust us? We have to become worthy of trust. Trust is given when it's deserved. So as a woman of color who actually grew up in those communities, my frame says, well, what have you done to become worthy of my trust? That's the thing that I bring that's different. That as a woman, as an African American, as somebody who grew up in a community that in Chicago has declined for lots of reasons, that lived experience drives me to reframe that question for my colleagues. What have you done lately? Like, why should I trust you? And even as an African American, there was a point in time in my career when I thought, am I being true to the community that I come from by trying to convince people to trust an institution that by all accounts, their distrust is merited? That's the thing that I bring that's different, is a reframing of classic questions that we ask ourselves.
Thank you so much for bringing a reframe to this entire conversation today. I look forward to seeing you in person and continuing this conversation at the live event, and can't wait to catch up with you and the rest of the network participating in the NCQA Innovation Summit. See you then.
Thank you, Vanessa, for inviting me to have this conversation.
Thank you so much, Vanessa.
The Women in Quality reception and panel discussion will take place at 5:30 on Thursday, November 1st at the NCQA Health Innovation Summit in Nashville. Learn more about the summit at ncqa.org.
Thank you for listening to Quality Matters. You can always learn more at ncqa.org, and be sure to subscribe to Quality Matters wherever you get your podcasts. We'll see you next time.